Post-prednisone side effects? What can you expect after stopping prednisone? I had a person reach out in the comment section on YouTube asking this question. Dr. Megan, can you make a video of post-prednisone side effects? As most of the time, it's always only the side effects. For example, during prednisone, we have high blood pressure, but after prednisone, it goes the opposite, like low blood pressure. Same with high blood glucose, it gets too low after prednisone. What an interesting insight that some of the side effects after stopping prednisone are the opposite of while you're taking prednisone, but not all of them. So let's talk about what you can expect when stopping prednisone. What side effects might appear or get worse after getting off of prednisone. And throughout the video, I'll be sharing tips of how to manage these side effects with a special gift at the end of my best tips. So the reason side effects appear after stopping prednisone is because of how prednisone works to begin with. Prednisone is mimicking our body's naturally occurring hormone called cortisol. And cortisol is normally made by a whole system in our body called the HPA axis, the hypothalamus, pituitary, and adrenal system. And they send messages to each other to keep building our normal cortisol making system. But when you take prednisone, your body essentially kills the messenger that keeps the system going. And so you no longer make cortisol on your own. That means you need to give your body time to turn this whole system back on before totally stopping prednisone. This is why you don't want to go cold turkey, right? Because your body's not able to make its own hormones yet. You've been stopping it by taking so much prednisone. And it can take days, weeks, or even months to recover that system fully, to be able to produce adequate cortisol. And so the whole problem has a name called glucocorticoid-induced adrenal insufficiency. And that's the main source of post-prednisone side effects. They did a Danish study in 2019 to look at what side effects appeared after stopping prednisone. And these weren't people who just took prednisone for a few days. These people had to take prednisone for at least 3 months. They had increased risks of low blood pressure, with the technical term of hypotension, and a 2.5 times greater risk during the withdrawal period. Low blood sugar, which is hypoglycemia, and that was a 2.2 times higher risk. Number 3, they had electrolyte abnormalities, imbalances, especially of things like sodium, leading to hyponatremia, with a 1.5 times greater risk. And finally, gastrointestinal symptoms, with a 1.7 times greater risk. So a lot of these are opposite symptoms to what you'd experience while on prednisone. Side effects of high blood pressure and especially high blood sugar are very common while on prednisone. In fact, prednisone's entire drug class was named after this effect on blood sugar. They're called glucocorticoids, meaning glucose, sugar. The high blood sugar is due to increased glucose production and insulin resistance, where the high blood pressure is increased fluid volume and increased vascular tone. And those things make sense while on prednisone, mimicking cortisol, because cortisol is designed by Mother Nature to help you survive disasters, giving you enough blood pressure to run away from something horrible, enough blood sugar to have the energy to run away. So when you stop taking prednisone, the body's cortisol levels essentially drop dramatically. Temporarily, but it can lead to opposite effects. You no longer have the pressure to have high blood pressure and high blood sugar. So without enough cortisol, the body struggles to maintain the vascular tone, leading to low blood pressure. Without enough cortisol, the body struggles to maintain proper blood sugars, leading to hypoglycemia. These effects are part of adrenal insufficiency and can last until the adrenal glands recover. The Endocrine Society describes other symptoms of adrenal insufficiency, such as fatigue, dizziness, nausea, and even fainting, particularly in situations of stress, like severe illness or physical exertion when cortisol demand increases. But it's not just the physical side effects to be concerned about. There are also mental side effects, emotional, psychological complications of going off prednisone. Prednisone has profound effects on the brain and mental health. So withdrawal can lead to psychological, cognitive, and behavioral disturbances. I found several articles about this, one written by Judd in 2014, and they mention the following neuropsychiatric events during withdrawal. Mood swings, irritability, and depressive symptoms are common. Another study by Farday and his team looked at side effects that appeared after stopping prednisone. Mental complications that appeared only after the last dose of prednisone. And they reported this as person years. So if 100 people were to take prednisone for a full year, that's 100 person years. So these are incidences per 100 people taking prednisone for a whole year. And they said that there were 11.1 incidences of depression per 100 person years. These are feelings of sadness, hopelessness, or even restlessness. Incidence of 3.9 for delirium, confusion, or disorientation. These are cognitive complications or decision making. A lot of people call this brain fog. The incidence for mania was 0.4, and the incidence for panic disorder was also 0.4. This is a heightened reaction to everyday stressors, and then an incidence of 0.03 for suicide attempt. That means it's incredibly rare. Most people do not attempt suicide while on prednisone. It's probably related to that heightened depression incidence that prednisone is causing post-prednisone side effect. And this is still very small, but it is 7 times more common in somebody than if they had not taken prednisone. Only 0.03 out of 100 person years attempt suicide. But if this is you, please get help. It's not you. It's not real. It's the drug. The drug did this to you. And please, your life is worth it. Contact a suicide hotline. If you're in the United States, dial 911 or 988. This is a suicide hotline. Tell them you took prednisone and they can help you work through this. Your life is worth it. You are worth it. You might be wondering, why would those mental complications happen post-prednisone? I already mentioned the HPA axis and how it's been turned off. It's in deep sleep. Sudden withdrawal of prednisone can lead to insufficient cortisol levels, contributing to emotional instability and cognitive impairments. Long-term prednisone use alters brain structures involved in mood regulation, like the hippocampus and prefrontal cortex. So who is more likely to experience these post-prednisone side effects? Because not everyone does. Some people stop taking prednisone, no problem. Life goes on. They're okay. But in that Danish study, they found certain risk factors that possibly may predict it, but there's no good evidence yet. But here are some things that may be factors to consider. First is higher cumulative doses of prednisone. Basically, if you took a lot of prednisone over time, you're more likely to have this. They specifically had the threshold of 3,000 milligrams of prednisone or its equivalent. That increases the risk of adrenal suppression. So, for example, if you only take 5 milligrams a day, that's like 1,500 milligrams per year. So you'd have to take it for 2 years at 5 milligrams a day to reach the 3,000 milligram equivalent. Second is longer treatment durations. Generally, treatments lasting longer than 3 months were more likely to lead to adrenal insufficiency. Number 3, age. Older age adults tended to be more vulnerable to this. And 4, concurrent medications. For some reason, antibiotics used in conjunction with prednisone may worsen adrenal insufficiency. So how can you manage these post-prednisone side effects of glucocorticoid-induced withdrawal, adrenal insufficiency, mental complications? Number 1, tapering prednisone is vital. Gradually, slowly reducing the dose of prednisone over time is important to allow the adrenal glands time to recover. Abruptly stopping prednisone, going cold turkey, can lead to adrenal crisis, which is basically your body going into shock, potentially multi-system organ failure, and you die. We don't want to do that. So always follow your doctor's tapering instructions so carefully and be in touch with your doctor if you're ever feeling off. Be aware for those symptoms of adrenal insufficiency: dramatic fatigue, low blood pressure, low blood sugar, dizziness, nausea, and maybe even salt cravings. Definitely seek medical help if you're experiencing severe symptoms like fainting or extreme fatigue. There's even potential thing that doctors can do called stress dosing to help you get through a hard time, like an illness or a very stressful situation in your life. You may need extra prednisone to deal with that stressful situation. And then monitoring. Your doctor can check blood tests, electrolytes, blood sugar, your blood pressure. So what are some lifestyle changes that you can make? Well, stay hydrated. Make sure you're drinking enough water, and whilst after taking prednisone, make sure you're getting enough sodium. During prednisone, remember you're retaining sodium, so you don't want to be using electrolytes that are high in sodium. But after prednisone, it's a great idea to use those electrolyte supplements like Elementi or things like that. Maintain a balanced diet with adequate carbohydrates, proteins, and good fruits and vegetables to help you get the electrolytes and proteins that you need. And then avoid sudden physical stress. Don't suddenly run a marathon after stopping prednisone. That could really potentially put you into adrenal crisis. If you want to know my other best tips about how to manage prednisone, my best tips for how to recover from taking prednisone, just click the link below to download my prednisone checklist. The principles in there are true while on prednisone, and most of them are still true after stopping prednisone. And that way you can do all that you can to minimize your side effects, to feel as well as possible while on prednisone. Signing off is Dr. Megan, your prednisone pharmacist.